Welcome. Hello, everyone, and welcome to the 26th GatherVerse event, the Virtual World Symposium. Our panel today on virtual worlds of healing, hyperscaling health. My name is Hipólito Caradona. I'm a CEO, co-founder of AugLab, where we're pioneering innovation in AI, XR, and health training in the laboratory. Also director of Hollow Practice, focused on immersive practices in healthcare. I'm absolutely thrilled to moderate the discussion. We have here leaders, doctors, organizational professionals that are taking their time. We're very, very grateful for you all. If you would, please give us a little bit about yourself and what drew you here to this particular community. May our gather be well, and let's get started. Let's get to know the panel, please. We'll start with you, Dr. McDowell. There you go.
Hi everyone. Thank you, Hipólito. I'm happy to be here. I am Lori McDowell, and I have a PhD actually in chemical engineering, and worked in chemical engineering for a number of years. I'm now an author, a coach, and I really work on healing from within. So I'm not a physical medical doctor, but I work with a lot of people on healing their lives from within, from their mindset, and creating the life they desire. And it's such, I end up referring a lot of people to medical doctors as well. So I'm happy to be here. And I think the virtual world is very important when it comes to this. So I'm happy to have this discussion. Thank you.
Thank you. Thank you so much, Doctor. Mary?
Hi, everyone. I'm a hypnotherapist. However, I spent 20 plus years in the media industry working for PBS, Sesame Street as a writer, producer, director. And I chose hypnotherapy because I found that a lot of people in my industry, including myself, were suffering from a lot of pain. So I delved into it because, let's face it, if you're in the television industry or the media industry, you already know how to hypnotize everyone. So I use this for the good of, I hope, my community. And I am very fascinated with the VR side of things and the AI side of things, because we need more therapists and we need more technical help in this world. So I'm interested in this tech renaissance that we're experiencing now.
Absolutely. Absolutely. Great. Amy.
Well, hi, thank you so much for the opportunity to be here. My name is Amy. I own Hidden Consumers Consulting, and I actually show my clients the connection between website data and human behavior. But I am a disabled person, and I believe we need to be inclusive on all levels, including our technology. So I am a huge disability advocate. I'm with a number of organizations where we fight for more inclusivity, and I'm really, of course, when my clients work with me, they have to be ADA acceptable. So I run into some issues there, but I'm really here because disability is huge. And with the numbers showing, with the way COVID has panned out, we're looking at 60% of Americans with disabilities. We have to be inclusive, or we're ignoring a majority of the country.
There you go. There you go. Thank you. Hanan, please.
Hi, everyone. Happy to be here. I'm Hanan Marabi. I am the founder of The Legacy Is Me and Earth Angels. GatherVerse speaks to me because I am also a nurse, and in my Earth Angels work, I have built a fish farm in Ghana, West Africa, virtually. And so I feel like I have a seat at the table. So, and I've been to one of these before, and happy to return again. Nice to see you all and good to meet you all. Thanks for having me. Yeah,
we're happy to have you back again as well. So let's dive in. Let's roll up our sleeves and start chopping wood, as our friend Christopher would say. We have the first question here, and I think that what I'll do is just open it up to anyone that it speaks to. There are some pointed questions that I won't ask specific members, but I think this is a free for all, if you will. The first question is, how can virtual worlds enhance access to healthcare services and resources? Who wants to dive in?
I will.
Please. Well, it's much of a continuation of what you were just speaking of, right?
Yeah. So it's really cool is that being on the business side of the world is I actually have some networking connections that are patient advocates. and they're actually working with researchers to create patient-based technology to help medical communities for just this, to make access more accessible, to give us more resources so that everyone has equal access and we're not being excluded from our own treatment plans.
Right.
I think a big part of this, though, is COVID helped. Let's be honest, it helped us really advance our technology and how we use it to really make at least like even basic appointments more inclusive. I personally have tons of allergies. I can't walk into a clinic or a hospital without having a reaction. Having like basic technology so that I don't have to step out really makes life easy. So there's a lot of advancements coming, but the key here is we've got to work with the patients to figure out what the patients need, not just what we think someone needs.
Right. That's great. Mary, can you speak to that a little bit more?
Sure. I mean, as a therapist, I work a lot with exposure therapy, and I'm working in the virtual world with post-traumatic stress disorder. But just like Amy was saying, the last time I was on the GatherVerse, I really expressed the fact that COVID really showed us how much of a deficit there is in the health world for people who are suicidal, for people who have signs of cancer. There's so many issues that we can't even. And actually, I was reading about something on the National Institute of Health that said that just in like one student environment, it's 400 students to one therapist. That's not even speaking of other countries. That's like, think California specifically. So if you think about that and entering hospitals, there is this lack of the right resources. And I think that with technology, especially with I hate to say this, artificial intelligence, but it can be the triage to the stepping stones towards the people that need to go, that people need to go to specialized. For example, the way they're now using remote, I want to say remote viewing, but bio monitoring, it is possible to look at someone's pupils, to track their habits, to track the patterns of the way they're using their iPhones or their computer, mobile phones, and tell if they have onset dementia, or to tell if they have autism. So it's really fascinating. And I think that, like, for example, the NHS has just introduced a program, NHS being for the UK, United Kingdom, which is an AI bot service that will be a mental health chatbot, and the first step to help people towards the right direction of who they need, including probably some I don't know the details of it, but I know it's called Olympic Access. And it's actually recognized by the government. And I hate, like I would say as a therapist, no, we just need more humans out there. But yeah, we do, but we also need to be able to direct people to the right humans and not waste time, with emergency services being totally exhausted with what happened in our last pandemic. So yeah, I really think that there is a lot of stuff that we can do moving forward with technology.
And speaking of the people that we're trying to help in way of turning the tables on the healthcare providers and their mental health, let's go into the next question. In particular, I want to ask Dr. McDowell here about the how virtual environments can support mental health and well-being, maybe particularly in the healthcare space. Hanan, you can comment on this as well. For nurses, for frontline workers, there's a heavy load, and it's not just physical, but it's also mental. Dr. McDowell, can you comment on that a little bit?
Yes, I can. So really, I think a lot of it has to do, in this day and age, we're all working really hard. We're all so busy. And part of it is we don't want to take the time for self-care and for worrying about mental health. That combined with the embarrassment, the fact that, we don't want to admit it. We don't want someone to see us at a mental health clinic. And the virtual environment really supports us in that one. It's a lot quicker to go on a virtual site and talk about this. You hop on your computer and you're there. You don't have to get in the car, drive there, make an appointment far in advance. I know I tried to make an appointment with the doctor for something, and it was like 4 months in advance. It's like, well, in 4 months, I'm hopefully be over this. So it's that ability to get something quickly and to get something from the comfort of your own home, as well as you don't have to worry about, we will share things with whether it be an AI bot or an online physician or a therapist. If you're sharing through the camera and the computer, we tend to be more more vulnerable, more open. We're not worried about sitting in a room with someone where it's, I've seen so many people lie to, they go to therapy and then they lie to their therapist, which kind of defeats the purpose. But when you're online and you're not in that same room, you're a lot more open and vulnerable. So I think from a mental health perspective, people can get the help they need because it's easier. And then there's the finance cost. It's less expensive. So there are a lot of benefits to the virtual environment to support that.
Yes, definitely. Hanan, please.
Yes, yeah. I wanted to, touch on a little bit about everything that you all said. So absolutely, mental health. First of all, we all have mental health, right? I mean, it's a part of all of us. And so agreed with Mary that, I too sigh whenever jobs are taken away from humans, but time and place for that. And in this case, it is so needed for the ability to have that access virtually, because I know that patients, even without established care, even without a doc, even without insurance, you can now find virtual providers to listen to you for 10 minutes and prescribe your meds that you need so desperately. And like Lori said, a lot of patients, people, they struggle to go back into the hospital or, a clinic or what have you for various reasons, access, stigma. Regardless of the reason, though, they can log on and get care right then and there. And then also about how COVID, it's just another story of how something so painful can teach you so much. Because yes, COVID was awful, right? And still continues to be, but we learned, exponentially what the virtual worlds can do for us. And so we all now can access care virtually, regardless of the need. And so I think that there's definitely a space for virtual healthcare in terms of access to many.
Love that. Love that. Yeah, thank you. Let's push forward because there's so many good ones. I want to get to these, but I was hinting at it a little bit before. But how are virtual worlds being proposed to train healthcare professionals and improve medical education? Anyone? I almost want to answer this one. Well, because my tool is a training tool, right, for laboratory, and there's so much of a burden placed on this complexity. It's overwhelming for people. It's the gadgets are advancing faster than we can even learn about them. But what about in the hospital, Hanan, or anyone who wants to jump in here? How are we using these virtual worlds to lower that learning curve and lower that barrier to entry and get people going and firing on all cylinders as soon as possible?
Sure, I can start that conversation just because I'm in it. So in the hospital scenes and in the healthcare scene, virtual in terms of education is now, if you don't have it, you are lacking. Most hospital systems that I'm familiar with use an onboarding that's virtual. Of course, there'll be some in-person on-site training, but there is usually a virtual element, and that's just for onboarding and learning journeys, etc. But then they also have doctors learning virtually with computers, how to use certain systems, how to use robotics for surgeries. So the space for AI in healthcare is huge.
It's great. It's great.
Yeah. I can add something just from my experience in the chemical engineering. We do a lot of virtual simulations and in bioengineering as well. And to train a healthcare, I mean, you can simulate a mass catastrophe, which you couldn't do that in real life. And yet you can do that virtually, simulate it, get people used to it. You can, simulate an epidemic or something. So you have the ability to do things to train people in ways that you couldn't do in real life. And I think that just really improves the medical education where people, the healthcare professionals are more prepared because they've experienced it virtually.
I'm going to turn the conversation slightly on this, and I think that's all great.
Please.
My concern is, how do we know the AI is picking up the right information? That is I have multiple conditions. I'm a chronic patient for like all my life, but I have two conditions. One's an orphan disease. Like I'm one of 100 people with it. You really think AI is going to help you with my case? Probably not.
Okay.
Mainstream, you have a cold. Excellent, AI is there for you. We have MS. Let's be a little bit more cautious here.
Yep. Let's be fair.
I'm so excited about what you're saying, because that is something that I wanted to bring up, because we have to be realistic about, it's not the be all and end all, the utopia, in actual fact, it opens up the black box, and the black box in AI terms means that things like hallucinations, which is the technical term for AI, can make stuff up. Right. And it's been doing that. And I actually speak to a lot of people. I'm in a pharmaceutical area where there's a lot of big companies, and they have to deal with, when they're making new tests for their products, that they get these answers like that it's going to work with this, clientele or whatever, but it's not necessarily true. So there is that sort of accountability, and there is none currently for, where is this information coming from? Is it accurate? And like you said, Amy, this is a big one. It can be trained on depression, but there are so many different kinds of depression, and so a bot that's trained on like depression may not pick up the sort of behavioral examples of someone with ADHD. And so this is where, do we train a lot of these different things instead of it being just universal, or can you make something that's universal that can actually pick up almost anything? And when you Dr. Google, you'll notice that, that pain on the side of your shoulder could be 1,000 trillion things that, are quite scary. And do we want to trust AI to diagnose? I don't think it'll get to that. I think if we're sensible humans, what will happen is that AI will look at the person or take the sort of symptoms and say, this sounds like something the doctor needs to deal with, or the therapist. And in actual fact, all of these programs are now saying that. They're sort of saying, this is not a replacement for your doctor, right, your psychiatrist, or your therapist. And even I say that as a hypnotherapist. When I give guided meditation, I say, hey, please don't operate heavy equipment. And if you have any psychological problems or physical problems, please consult your doctor. Right. So that is a big one. And I think that is going to be a big topic for us moving forward in the future.
It's huge. Yeah. And it goes into, I think the next two questions actually we're already talking about. Let me just move over here to it, because the way in which the telepresence, holoportation, how are the virtual environments helping the remote patient monitoring or telemedicine here? So here's the question. But one of the things that we're diving into, I love that we kind of just dove into AI, which I do want to hold the distinction, right? Artificial intelligence is a part of a virtual world, right? It's a component of the virtual world, but the virtual world is accessible between two human beings as well. So I have a healthcare professional that's stepping into this environment. How does that person stepping into the environment with their patient, how can a virtual world hold potential there and help in that regard? And then we'll jump back into AI for sure. Promise.
So I was going to say, first of all, Amy, I love your laugh. Has me cracking up every time you laugh. So cute. And secondly, I would agree that just with everything else and with virtual, worlds and AI, you need checks and balances. So for me, if I have a patient that I'm looking at virtually and they have a monitor on, and the monitor is beep, 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 telling me that they're having arrhythmias and I need to, check on that. But I'm looking at the patient and she looks fine. I'm going to talk to the patient too, right? And that trumps what I'm being told by a machine. So I think that just with everything else, you need to use your judgment. You need to listen to the patient. That's actually another whole topic about patients who do not get heard and listened to. And so we cannot forget that human piece. What is the patient telling you versus what is the machine reading?
Great. Fantastic.
No,
Listening.
I think
how can you help us listen? Go ahead, Amy, please.
I was going to say, I think part of how it's helping us, though, is really in helping doctors get information on things they might not have knowledge on. So 20 years ago, I had an injury that was at that point a rare disease, and someone my age never would have, they didn't connect what I ended up having to my age group because I was 40 years younger than the average age. Had we had the virtual abilities 20 years ago, it might not have taken 13 doctors in 4 years to figure out what was wrong with me.
Yeah.
Right. fast forward to 2013, we're more in our virtual worlds already. I have this unusual condition. And the first neurologist I talked to outside of my primary neurologist was like, oh, hey, I think it's this. Let's test and do what we can. And boom, he was right. But he had access to online medical journals that allowed him to read about this rare group of people. And I happened to fit every single condition.
Wow.
So that's how I got diagnosed. And it was because of those virtual worlds. And I think that's what we need to see continue to happen, is more doctors having that kind of access during appointments to get us to a faster place for those types of diagnoses.
Absolutely. Yeah. Thank you.
And I would just say it's amazing for rehabilitation. It's amazing for dementia patients. It's amazing for people who have memory loss, blindness, deafness. There's a million different things. Well, I mean, virtual world. Even now, yes, they actually have different virtual worlds that can help with all sorts of different challenges that people have, and especially in the situation with therapy and rehabilitation and therapy talk and all these different things for patients. It is definitely a first responder. It could be.
Yeah, definitely.
Or preventative.
Absolutely. Let's jump in. Oh, so we talked a little bit about this, but how can the virtual world or virtual worlds facilitate support communities for individuals with chronic illnesses? Chronic illnesses. This is great. I mean,
this is so me.
Everyone jump in at once. Come on in.
First, I have found one amazing chronic group. It's called the Chronic Boss Collective, and it's formed around our founder, Lily, actually comes from the mental health field. She's struggled a lot, but what she's been able to create in this short time is different communities of people who can relate on different levels, but then we're also advocating for each other. So we're introduced to a much larger group of advocates. So how do we help and not get stuck in the, I don't know what to do next, but we have that community that can give us support. And if we just want to sit and wallow for a while, they're going to let us sit and wallow. But when we're ready to move forward, they're there with their hand out saying, let me help you. What can I do? It's that very inclusive feeling. And that's what we need more of. There are not enough organizations that do things like that. Mm-hmm. I refuse to go to support groups because all they do is tell you all the things that are wrong with the world and you're never going to get better and just commit suicide. Like, no. There's a better world out there. We just have to try for it.
Come on.
Yeah. And I would use I do use the virtual worlds to put my color therapy groups together and my guided meditation groups together. And I think it is important because, yes, not only can you meet in a different environment, a safe environment, that's a big one, it's virtual, right? It could be anywhere. It could be a beach. It could be a wooded forest. It could be another planet. And that in itself is a form of subconscious relief. It helps the amygdala to be like, well, either fight or flight, but generally it relaxes their parasympathetic immune system. It sort of makes them relaxed, especially in a group. And then if you have a therapist or you have a guide, it can make a big difference in chronic pains. I actually that's one of the things I specialize in because I also suffer from immune issues and chronic issues. And I found that every time I give a group session, I feel wonderful because the therapy is both for the therapist and the community. Absolutely. So definitely a thing that needs to be pursued more, these virtual environments to help the subconscious, the conscious, and the community.
Yeah, so just add a little to both Mary and Amy said, I think that, the support communities in the virtual world are so important to take that you're not alone and to give you a place to ask questions, because having support, knowing you can ask questions, particularly someone who's at a different stage or something that's unusual. I mean, you don't want calling a doctor to ask this question. Often the doctor doesn't know, but having people who have been through it, having people who will support you just makes a huge difference. And not just for the individuals, but having similar communities for the caregivers and the families is also incredibly valuable.
Super important. That's critical. Let's hop over here now, though, back to the healthcare. Hanan, let me ask you, what ethical considerations must be addressed when using virtual worlds in healthcare? I think that we can really rely on this community for bringing this always to the forefront What are we dealing with in the healthcare world with virtual worlds?
So a big one is those rural towns and rural areas, even in the US. I mean, just looking at the US, we have rural towns that have very little access to actual, brick and mortar facilities. And so it would be, it's crucial to look at those rural areas and ensuring that they have virtual access for healthcare. Bringing this back to my nonprofit, Earth Angels, where not only have we built this fish farm in a rural Ghana, but we've also forged relationships with the local clinic that provides healthcare to the masses. And so what we've done is through virtual telehealth, we have provided these the patients that the clinic just does not have the capacity to help. We provide them with consultations with nurses, doctors, different providers, something we would not be able to do if not for the virtual world. So I would say remote and, disparaged, underserved, underprivileged communities to be taken into account most of all.
Yeah, building that bridge. It's very important. Anyone else want to chime in here, please?
I guess the ethical considerations are back to that whole who's giving the information, what are the biases? Every single program is going to have a bias because it is based on who is programming it. And if it's making information up from wherever, that's also a problem because it can do more harm than good. So that has to be considered. We have to have access to the black box, and we have to really work on getting the right information into these programs so that they do not mislead people and cause more harm than good. That's the biggest thing in healthcare.
Huge, absolutely huge. We'll touch on more of that. Go ahead, doctor.
Oh, no, I was just saying the other area from an ethics point of view is just responsibility. I mean, if it's who is in charge of the information? I mean, if you go to a doctor and the doctor makes a mistake, it was clear who did it. But if you go to something where it's AI led or telemed, but it's supported by AI, there's really, who owns the information and who is responsible for making sure you're getting the correct information. Because there is, if something is wrong, it's, there's no bot that's going to correct it necessarily. So
yeah, access to the black box, as Mary pointed out. Yeah, it just can't just be a black box, especially when we're dealing with lives and the details and just the preciousness of life here at the cross section of healthcare. So let's think about this and change the page. This is fun. How can virtual environments be designed to be therapeutic and supportive for users? Mary, let's go to Mary first, but I'm sure everyone could contribute, please.
So, I mean, I absolutely love playing in VR. And if you look on my site, timeforchange.info, which you guys can look up. But if you go on it, you'll probably be like, what is she doing? Because I do things like with the color therapy and I'll be like, are you ready for today's color? And I blink and my eyeshadow changes and all kinds of silliness that gets you into this meditative state. And that's what's really amazing about virtual environments, because you can walk them down the path of serenity. They can choose where they want to be. You can work on their breathing. You can work on their comfort levels of pain. You never want to take that away completely, but you can release some of it. And that to me is the best part about a virtual environment, because if the person is in a bad environment, if they're in a tense situation, just for a little while, just like we used to use with our music, you can escape. You can escape the reality of what's going on and hopefully make changes that will, that's the most important thing with virtual realities. I don't want people to stay in them. I want people to remember why they love nature and go back into nature in reality. But in the inner cities and places that are where there's extreme poverty, or like on lockdown where you couldn't escape, you couldn't just go wherever you wanted to. I think it's important to have these, especially in those situations, set up so people can still virtually be with each other in a calming environment until they can get back to reality.
That's huge. That's huge. I love that. Until we can get back. I think about the people with fear of swimming, fear of the open ocean. Those virtual environments are going to help in that way. This is great. Go ahead, please. Yeah.
I was going to touch on more so, not so much the therapeutic piece, but for support. I worked on a project recently where I was working with some older folks who, towards the beginning of the project, I realized there were simple things that they just didn't know in terms of technology. And so just being able to share their screen and actually remote in and show them how to support, how to actually do all the tasks individually. And some of these ladies were, in their 70s and just didn't know how to use, simple things. But I was able to remote in and show them all these little things. And by the end, they just felt so supported and, like they had a seat at the table. And so something so simple as remoting in and sharing your screen and showing someone around, just a simple thing to support someone.
No, that's great.
Yeah. I was going to say something very similar to what Hannon said, but more on the design perspective. In designing these virtual environments, I think the designers do need to be aware that many people that are going to benefit for the most are not computer and tech savvy. So they need to make it simple to get in. They need to make clear instructions, particularly for elder people who are homebound and, their computer usage is very limited. They need to use big text and such, because I know I can't even read some of the sites I go to. They have this tiny little text with low contrast. So in the design, make sure that they are fun and easy to use so that people are going to get the most benefit for them. Because I know my mother, I sometimes try to share something with her and she gets so frustrated because she's like, well, I tried and I couldn't get in. And
yeah, it's important. Yeah, lower that barrier to entry and I think about like all of the ways in which we can actually, that this can help that barrier to entry, but there's also the virtual world presenting another barrier to entry. So it's a little bit, there's some tension there. And I want to be able to grasp that here, particularly in the research realm. For me, my world is in the biomedical laboratory. So this one is near and dear to my heart. But what roles what role do virtual worlds play in advancing medical research and collaboration? This is a great one. I'm really excited to hear the answers here from the panelists. Come on out.
Okay, I will, because so I'm actually a historian by trade. Like I did a lot of research and all, to get my degree. And I wrote a book called The Hidden Consumer. It's coming out next year, but it's about the food industry and the issues we're having with how our food is making us sick on multiple levels. But what was fascinating is going back and doing the research, because I only do primary sources, peer-reviewed research journals, medical, all that fun stuff. And you could have multiple countries collaborate on one piece of research. Like when I got my degree originally, almost 30 years ago, it was whoever was in your areas who you got to research with, or you had to you had to travel, you had to do this, you had to do that. And now I'm looking at peer-reviewed primary sources that are written by people in multiple countries on the same aspect, and they're bringing their different abilities to read that information and how they're interpreting and what they're seeing from their end. And it's just making our research so much more in depth. And it's bringing a whole new level of knowledge that we wouldn't have gotten had we not collaborated together.
Gigantic. It's unprecedented right now. And COVID really did a number on us when all the labs were closing down. And how do I collaborate how do I speak to a scientist in Belgium here here at the US? But it's great. No, please keep going.
Absolutely. I would add to that I'm speaking at the CCMC Symposium tomorrow. It's a certified case management symposium, and it took me months to research my presentation, and it was all done virtually. And I'm sure the same for all of the presenters. So if that answers your question, right? I mean, you can do it silently, quietly, and virtually and get it all done. Pretty amazing.
Yep. That's great. Fantastic.
Yeah, I think the one other role or the benefit is just the availability of knowledge. I'm sure, I remember when I did research, there were studies this was back 30, 40 years ago, but studies that would have been valuable, and I had no way of knowing they even exist. Yeah. And now some you know, your research may have a direct relation to somebody in another part of the world, and you have a way to find it. There's a way to share things online and virtually that you could never do in the past, and that just really can, you know, make medical research happen a lot quicker, because someone may have the key and found it, and you didn't know it fit in with what something else did, and now they're all connected.
Yeah, I think we underestimate how important community is in medicine and science. We're not going to advance further if we're not communicating the science. You don't even get reviewed or published if you can't articulate what you've done in the laboratory. So I harp on that a lot. It's not necessarily how smart you are, it's how collaborative you can be. I don't want to mess up this quote. It's like, it's one of our US presidents. It's not it's not how much you know, it's how much you care. I butchered it. I was scared to do it, and I did it. But it's just that, you know, it's putting in the forefront the community and how we can share from each other, and how that's really, really important to drive technology, to drive the new scientific breakthrough, which leads to one of the, this is a very relevant, very recent question here, but how can virtual technologies help in managing public health crises and disseminating information? Amy, do you want to tackle this? You just spoke of a particular crisis, and that's in particular our diet, right? And the food that we eat. Can you talk about that a little, please?
Yes. So just to be open, I am allergic to corn and all corn derivatives. So I'm basically allergic to life, which means all the ingredients in our food, medications, clothing, it's everywhere. Hence why I don't walk into clinics without getting sick. But what I found super fascinating is in all the research we were finding is that all the main ingredients I've had issues with are now being connected to high rates of kidney disease, kidney failure, heart conditions, and even death. Like, but that's information that's being kept quiet. Oh no, corn is safe. It's okay. We're not over making it. No, it's fine. It's like, no. We got to be honest and really look at what the research is showing us. Yeah. But I think part of the issue, especially here in the US, is we no longer have laws that really talk about truth in what we're talking about. We're not talking about both sides anymore. It's one or the other. We're pitted against each other. Yes. And if we really want to see this information come back around, we need something like the fairness doctrine to come back into play. We need to bring that fairness to both sides to talk and have actual conversations around it. Because right now, my voice isn't going to be heard unless it's in my book, because nobody wants to talk, because corn is a huge lobby. My voice is going to be silenced because they don't want to hear what the primary research is saying about what they're making the most money on. And at the end of the day, it's all about capitalism. Sorry.
Okay, go ahead and drop that. Yeah, we gotta find a way to combat that. Hanan, please.
I was just going to add a couple things. First off, to what Doc Lori said, and that is, there's only so much you can read from a microfiche, an encyclopedia in a library 20 years ago, right? So being connected virtually to the world, you know, we learn about scalability, we learn about innovative solutions. Look at COVID. We found out that Cortem, a simple malaria drug in West Africa, was saving lives with COVID, you know, so, and having been raised in Ghana, West Africa, where we got malaria like the common cold, that's something we took all the time. Come to find out, it saved people from COVID. So were we not connected and had virtual worlds, we wouldn't have known this in the West, where we have the best medicine. And yet we were, you know, people were dying on ventilators because they didn't need to be on them. So lots to say about what the, you know, innovative solutions can happen across the world virtually.
Absolutely. We got one more question coming up. We're wrapping up on the 5 minutes. Mary, please finish this out.
No, just to say that the apps, you know, the apps that we create for health and wellness, you know, we had the Wii how many years ago? With VR, it's going to get even more immersive. And I think those apps can help with, as I said, rehabilitation for people to get back up walking, to get back doing exercise, to even down to autism, helping children who are non-communicative or find social cues very difficult. These apps are helping. There is technology. Look at me, I'm ADHD and an autism spectrum. So there you go. It's helping us communicate easier because it's showing some social cues, and it's showing there's just so many advancements in technology that we can use in the VR world to help with health and wellness, through exercise, through training, through all of these immersive or mixed reality platforms.
Yep. No, and it's great because this is the future. We want to end on the future. Let's dream a little bit here, as we do at GatherVerse. What future developments could revolutionize the use of virtual worlds in healthcare? This very unique but very important cross section.
I would just say all of the technology with glasses, we're not there yet. There's glasses that are not handling with myopia and stuff, but I would say Vuzix and a couple of other ones. What's his face just released Orion, and the lighter these glasses get, they'll probably move into contacts. I'm not doing the Starlink thing where they're putting it into my brain. No, that's not happening. But I know they're using this for technology for hearing aids and stuff like this. But I would say that I want this to become Star Trek. I don't know if there's any other Star Trek nerds out there, but I want to be able to have those environments where we can really revolutionize, because tech is with us now. We have to just face it. It's with us. So how can we use it for the benefit of our health? Monitoring our hearts, helping us with psychological issues, helping us to see different perspectives. That as a therapist, I want to do, but I can't reach out to the trillion people that we have on this earth, So there's not a trillion, but you know what I mean? 8 billion people. So I think that the virtual worlds will improve greatly with a little bit of the AI, a lot of artistry, a lot of creativity, and getting those glasses and contacts and things down to the size where we can actually see, and it's easy. Right. You just pick up those glasses and it's there. Right. Grandma can have a program for her that will help from 2,000 miles away.
Okay, we're going to go Dr. McDowell, Amy, and then we'll finish with Hanan. Please.
Yeah, it's a really interesting question. And I had an experience recently. I was in Phoenix and I took a self-driving Uber. And it was really interesting. There was no driver. It just took me from downtown Phoenix back to my hotel, which was fascinating. And I just see, it's kind of a virtual technology, but someone who is vision impaired or could not drive before could have a car that can take them where they want to go. And when you take that even further, I mean, there's just so much that the virtual world could do to make up for our physical handicaps that we haven't been able to do. So it opens up things that were never available to people who do have a disability. And I think that could be fascinating.
Huge. Gigantic. Great. Thank you, Amy.
Yeah, I'm right there with those last comments. But I also think that we have the ability to do so much video, but we're not using it in those medical emergency situations the way we should be. We don't have the infrastructure to handle that kind of internet connection, I guess. But I think we need to do more with video in order to bring more in. Like if you're in an emergency situation, why can't you do a video call to 911 and say, here's what's going on? So they have a visual on it to better communicate with the emergency services team. A lot of those things aren't going to be possible, especially in rural areas. So how do we make that happen?
That's great.
I would say XR reality, the duo, the combo of real and virtual environments. I think that's going to explode. But so much of what we've said, safe spaces, enhanced accessibility, real-time interaction, personalized treatment, community support for the elderly who are lonely and have nobody. I mean, the list goes on and on. Behavioral simulation, data-driven insights. I think all of these things are going to explode due to virtual worlds and AI combined.
Fantastic. Okay, well, you know what? What a blessing here to be here with you all. And again, 26th GatherVerse event. The community welcomes you. We're very, very grateful for you. We hope to have you back. I want everyone here in our community to give our panelists a warm embrace virtually as we do. May our gather continue to be well and have a wonderful day. Thank you, thank you, thank you to all the panelists. and to the GatherVerse community in general. Appreciate you all.
Thank you so much for
Thank
having
you.
us. Thank you.